Gone are the days when cancer services were decentralized, with patients getting diagnosis and treatment in different localities of Mulago Hospital complex. With the opening of the Center of Excellency at the Uganda Cancer Institute, all services will be received at the Uganda Cancer Institute, Upper Mulago Hill. The director of Uganda Cancer Institute, Dr. Jackson Oriem, says the center is now equipped with modern equipment, and it is to provide more specialized services than ever before. According to Oriem, 20,000 cancer patients will be diagnosed and treated every year, with only delicate cases referred abroad.
If the patients who go from here abroad showed what we have here to the places where they go for treatment, they will be very envious. We were operating in most cases at basic levels, I would say. Those are good, but this is now going to be increasing our capacity a level higher.
Another intervention for Uganda Cancer Institute is the cobalt machine donated by the International Atomic Agency. The equipment, worth 500,000 euros, is to supplement the existing inefficient cobalt machine in the treatment of cancer patients. The equipment uses ionizing radiation in the treatment of cancer and controlling or killing the malignant cells, and also in the prevention of tumor recurrence and early stages of breast cancer.
This is in the area of radiotherapy, so that equipment will be brought here, and what we need to do is to have a place for it, and that place is called a bunker. We have already started the process of building that bunker. We are going to have multiple bunkers, and we are actually projecting into the future. We are designing these bunkers such that they should be fitting equipment of tomorrow, not today. So that is what we are doing.
The chairman, board of Uganda Cancer Institute and founder member, Professor Charles Olweny, says incidences of cancer are on the increase. Professor Olweny says 4 years ago, incidences of cancer stood at about 200 persons per 100,000 people, compared to the present number of 300 per 100,000 people presenting with cancer. This is attributed to the present lifestyle of many Ugandans: smoking, excessive drinking, junk food, and lack of inadequate sensitization, among other causes.
Ugandans really need to understand what cancer is, what the signs are of cancer, and the role it plays in society. You know, we here at the Cancer Institute have clearly seen, families deprived of mothers, children dying too young, fathers, who are the income earners for a family, lose their battles with cancer.
We know that even as we applaud the partnership that created this facility, there are still health centers across the nation that have no electricity or running water, and that struggle with inadequate staffing and medicine stockouts. We know that the recent typhoid outbreak challenged the health system's capacity on many levels.
Speaking at the opening of the new center, President Yoweri Museveni called upon Ugandans, and especially doctors, to use a holistic approach when dealing with the cancer, instead of using fragmented methods that will yield inconsistent results.
Prevention is better than cure. So if we take all the preventive measures, then we can reduce the disease burden, spend less drugs, less money on drugs, and that also helps us to deal with the other issue of ours.
Early detection of cancer, one can survive, as it is the case with Leah Kasule, who has now lived 17 years after she survived cancer. With today's facility, which has been opened, it is hoped that many Ugandans, over 20,000 people per year, will be diagnosed and treated at this new facility. Harris Tembo, WBS, Uganda Cancer Institute.